Advocating for America's seniors has been a long-time passion of mine, even a calling. My advocacy for seniors goes back more than 25 years when I was director of the Illinois State Council of Senior Citizens, well before I was a senior citizen myself, which I'm proud to say I am now. I worked then to ensure that the voices of older Americans were heard and their concerns were put before policymakers and their needs were met. And as co-chairs of the Senior Task Force today, along with Doris Matsui, my colleague, I'm very proud to join with all the rest of my colleagues to continue carrying on that work, advocating for older Americans here in Congress. It's fitting that we're getting this effort off the ground today in the first week of Older Americans Month. The focus of our task force, however, is to shine the light on the needs of America's seniors every day, year-round, by ensuring that there's affordable, reliable health care, financial security, and a dignified quality of life. In fact, I believe it's essential to the well-being of all Americans that we nurture a culture that respects and cares for the most senior members of our society. One of the most important charges of the Seniors Task Force is to keep the financial realities of older Americans at the forefront of policy making. We must consider the massive hit that many senior retirement savings took in the economic downturn. Many older Americans are still working or looking for work or depending on children who are out of work, and many are helping care for children and grandchildren hurt by the economic downturn. Representative Mark Schauer, a member of the Seniors Task Force, will tell us more about the recession's impact on seniors and the protections that Wall Street reform will bring. Another critical goal of the Seniors Task Force is to dispel myths. For example, older Americans are not a wealthy group. The average income of America's seniors, and this is average, meaning many are lower, is a meager $18,000 per year. Close to 10% of seniors were considered below poverty in 2008, and over a third of all Social Security beneficiaries in America rely on those checks to provide over half or more of their income. As a member of President Obama's Commission on Fiscal Responsibility and Reform, I know that as we work to balance our nation's budget, reduce the deficit, and grow our economy back to prosperity, we also have to take the long view. We need to protect Social Security, Medicare, and Medicaid, the essential programs that so many older Americans depend on to survive. And we have to keep in mind the ways to preserve and improve these programs as the demographics of older Americans continues to expand. Over the last decade, the number of Americans over 65 grew to 40 million, a 15% increase, and the trajectory of aging in America is only getting steeper. In the coming decade, the over 65 demographic will reach 55 million, a 38% increase. This is not an issue that we can ignore. And keeping Social Security, Medicare, and Medicaid intact is not only critical for the group of seniors who rely on those monthly checks to pay their bills, or for much-needed health care services and medications. Protecting these programs is essential for future generations who are definitely going to need them too. The Seniors Task Force is here to keep the concerns of older Americans at the forefront of public discourse and ensure that older Americans have affordable, reliable health care, financial security, and a dignified quality of life. This Congress has already made great achievements for the betterment of older Americans, and I think it's important to remind people about that. We have funded programs that provide employment assistance and a range of social services that help seniors age in place at home where they prefer to be. These include home care, transportation assistance, senior center activities, home-delivered meals, and grants to improve nutrition services. I'm especially proud of some of the provisions included in the health care reform legislation the Democrats passed this year. Representative Dina Titus will tell you all more about that today, including the facts about the donut hole or prescription drug costs, and how Medicare has been strengthened for seniors by cracking down on waste, fraud, and abuse. This Seniors Task Force is here to stand up for the basic protections of financial stability, affordable and reliable health care, and again, a good dignified quality of life into old age. It's going to focus on protecting older Americans' financial securities by shoring up protections against scam artists. Seniors are particular targets of scam artists, and identifying thieves who target seniors and prey on their trust and sometimes vulnerability. Again, Social Security, Medicare, Medicaid. And we'll also help explain the accomplishments of this Congress and help connect older Americans as well as their families to the many new federal programs available to them. Our new website, democrats.gov/seniors, will be a wonderful resource for that information. This is a critical time to redouble our commitment to honor the many contributions of America's seniors, our mothers, fathers, grandparents, and peers who have paved the way for our own successes and accomplishments and those of future generations. And now I'm going to turn over the box I'm standing on to Congresswoman Schakowsky, who's going to tell us about the Senior Bill of Rights.